what we're trying to do is essentially determine which patients have high risk PE and then be able to act upon them quickly. Now, I will say, at least at our institution, we're getting called about most of these patients fairly soon after I get alerted by the Aidoc algorithm. So, there's a number of situations where my phone goes off. I'll get the alert. I'll see that there's a patient with a large pulmonary embolism. I know that this is somebody that we're going to need to look at. So, I might call our fellow, or I might start digging in a little bit and sort of getting the information. And then by the time the team calls us, which sometimes is 15 minutes later, sometimes it's 2 hours later, depending on when they're getting all the clinical information, we already have most of that information. They're sort of like, well, hey, how did you guys know that? Like, you know that this patient had a history of lung cancer. Like, how did you know that? I haven't even told you yet. And we know that because we're getting alerted oftentimes before they will even call us. So it's not that we're sort of preempting the teams and calling them and saying like, why haven't you called us yet? It's that we're able to be more efficient and know the patients that we're going to need to be involved with. Certainly there's going to be cases where you see somebody that has a normal blood pressure and they're on no oxygen and they have a segmental pulmonary embolism. Maybe that person, I might go back to sleep. They call me, we'll give them some recommendations. They're probably not going to need anything till the next day. But you can tell the ones that are probably going to need some discussion, and those are the ones that the algorithm detecting those early on has really helped us to sort of be on the ball.